I'm Melinda Mueller from the Department of Political Science. We are here for Science Fest, and several faculty will be talking in a panel discussion today about poverty policy, and we'll be looking at it from several different angles. I'll be talking about how U.S. poverty policy works, what some of the problems are with how the policy is currently implemented, and what are the opportunities for improving poverty policy in the United States.
Because profit and human needs generally don't agree. An example that would probably be hit home to our students is higher education finance policy. We need higher education that's affordable to all qualified students, and instead we get mostly predatory student debt, right? Another example, kind of classical example, is unemployment and underemployment. Right now we have very high unemployment rates, even higher in places like Greece and Spain. We can all think of things that we'd like to see done that would improve our environment or our lives, or things that we'd like to see produced. We have lots of unused industrial capacity that could be used, for example, to produce high-speed rail. But none of that's happening, and that certainly is the case.
So to start off with, most of our poverty policy in the United States actually comes from the federal level of government. It's very fragmented into many different cabinet departments and government agencies, including Health and Human Services, which carries out the major formal poverty policy of TANF, or Temporary Aid for Needy Families. That is what we typically think of as welfare in this country. It came about in 1997. Prior to 97 was welfare that went back into the 1960s and then back into the Depression era. But poverty is in other government agencies as well. Most of our food policy for the poor comes from out of the Department of Agriculture. So SNAP, which is known more commonly as food stamps, the Supplemental Nutrition Assistance Program, comes out of the Agriculture Department, as does WIC, Women and Infant and Children Policy, and our school lunch and school breakfast programs. And finally, Housing and Urban Development manages our housing programs for the poor, so vouchers and rental support and subsidies for the poor in terms of finding housing. We're talking about billions of dollars every year. Most of this money goes to all 50 states. So in the state of Illinois, most programs come through the Illinois Department of Human Services. They take block grants, which are large, flexible funding programs from these government agencies at the federal level, and they carry them out. The research that's been done, one policy analyst looked at families who moved off of TANF grants over a course of 5 years and found that after being on aid, they were a little better off than they were when they were on aid. But there was no sign of social mobility. Most of them still got food stamps or food aid. Most of them were working in very low-wage part-time jobs. So we didn't have any evidence that this was actually working. The other thing that I want to note, or a couple of things that I want to note, the TANF grant for a family of 3 in 1994-95 was $432. That's what you would get for your needs for that month. It is still $432 because the program is not tied to inflation. So there's some other clear problems there too in terms of policy problems. I think overriding all of this is a great deal of public pessimism and cynicism. We don't like to talk about poverty. We don't like to work on poverty. Recent research in Policy Studies Journal looked at local media coverage of the poor and how we were framed in the media, and found a very clear connection between using terms like welfare queen and laziness and dysfunction and other really negative connotations. Not only shaped our views, we were more likely to think that when we heard that, but it also shaped how the state's public policy was pursued. So the more they had negative framing, the more you would see public policy that restricted access to aid programs for the poor. We don't see the funding from the state that's there. We don't see the funding from the federal government that's there. So we won't tackle this problem until it's a priority to us.
Okay, so Dr. Mueller was right. Nobody likes to talk poverty. Except this guy. This is my passion. This is what I research. This is what I do. Since I moved here 3 years ago, I was intrigued by the lack of poverty information that there actually was about the incidence of poverty here in the county, in Charleston, in Mattoon, in the surrounding area. And so instead of keep asking people where it was and getting an answer, well, we have no idea, I decided to do it myself. And so I created this little project called the Coles County Poverty Data Project. I use the U.S. Census Bureau's official statistics on the American Community Survey. The reason that I do this is because this is how decisions are made in Washington and elsewhere. Official government statistics inform official government decision making. And so if we're going to know how decisions are made, we're going to have to use that information ourselves. And so one important thing that I know and that is important to remember is that there are two types of poverty. There's absolute poverty and there's relative poverty. Absolute poverty means you're either above the official poverty line or you're not above the official poverty line. Based on how information is collected, this has a lot to do with how many people are in your family, how many children you have, but it's all based on the amount of income that you bring in. Relative poverty is in comparison to this poverty line at different levels. Relative poverty is a lot different than absolute poverty because you can feel a whole heck of a lot poorer and not fall below the official poverty measure. You can make some level of income not be counted as the statistically or absolute poor, but still not know where your next meal is going to come from, or still not be able to get an adequate nutritional diet for yourself and for your family. One line that I'm very interested in is the 185% poverty line. And the reason that this is important because this is an income level that determines a lot of what people who are poor or near poor get or don't get in terms of public benefit. For example, SNAP or food stamp participation, the free reduced lunch program for poor children in public elementary schools cuts off at 185%. And it is known through research and through the literature that 185% is a level at which people tend to not feel food insecure anymore. Okay, 85% is what we call the food insecurity line, where you might not know where your next meal is coming from. You might not, and if you do know where your next meal is coming from, that it's going to be nutritionally adequate for you. I focus, as I said, on the Charleston and Mattoon area. And the Charleston and Mattoon area is important because it's called a micropolitan statistical area, which the government uses as sort of a statistical geographic area to look at how places geographically are interrelated to each other. And our county, Coles County, Charleston, Mattoon, kind of make up this hub of this micropolitan statistical area where all adjacent counties that we share a border with are dependent on us and we are dependent on them for interrelationships, whether it be agriculture, shopping, healthcare, services, you name it. There's a strong integration of what's happening between these two areas. That shows at the center, Coles County, and there's some bright colors here in the middle of Coles County, and then it's surrounded by all other counties that we share a border with, plus Effingham County, which is down at the bottom. The reason that I have Effingham County on here is because it's the next closest micropolitan statistical area to our own. And so I call this affectionately the East Central Illinois region, and it is this micropolitan statistical area that I care about. So all of the other counties are there. So what this shows is actually the number of individuals, the number of individual people who are officially statistically poor by census tract in East Central Illinois. The closer the color is to red, the higher the percentage of individuals within that census tract are in poverty. And so you'll notice that the brighter colors are right in the middle of the picture, right in the middle of the map, right here in Coles County. This isn't too big of a surprise because we are the economic hub of the region. This is where the largest population is. This is where a lot of the industry is left. This is where most people are employed or trying to get employed. It's a university town, etc. It is the hub of the micropolitan statistical area. And so all the outlying areas are blue. The closer it is to blue, the lower the percent of the population who are officially statistically poor. And again, the closer things are to red, the higher the percentage of individuals who are officially statistically poor. Now, one of the questions that I always get, and this is what I'll end on because we're running short on time, is that, okay, university town, we get a lot of students, the campus is red, it's the highest percent of poverty in the area. How do you explain that? Is that skewing our data? And one thing that I always try to say whenever I talk about this is that poverty needs a scapegoat because it's not our problem if we're not poor. And in university towns like Charleston, but all over the country, that gets hung on the back of students. Students are poor, they don't work, they don't make a lot of money, and most of them are then going to skew the data. Well, the way poverty data is collected is, one, it does not include any institutionalized places to live. So any college dorm or any place that has a non-institutionalized population, like a nursing home or any jails, county jails, state facilities, people aren't counted. So the housing units on campus are not counted in this.
On the positive side, everyone essentially has an interest in changing the system. We just need to recognize it, and we need to recognize that indeed there are better alternatives, some of which even exist today and have popular support where they've been tried. So why don't we? Well, various factors contribute, but among them are a failure of analysis and a failure of imagination, both of which derive from the use of models that are inadequate to really describe reality and which constrain our ability to creatively see options for viable alternatives.
Okay. I'm going to skip ahead several slides. I've got lots of good colors and pictures here. And talk a little bit about how we can take care of this issue with census tract number 8. And what this graph shows is the difference in the percent of individuals in poverty when you include the campus and you take the campus out. And each one of these, and these are by levels of poverty, the 50%, the 100%, 185, and 200% of poverty. The difference when you include census tract 8, so the whole county, and when you take out census tract 8 is about 2 percentage points at each level of poverty. So the message is that it doesn't really skew it all that much. Okay? It's hard to hear, it's hard to think about, but there's a good level of poverty in the area, in East Central Illinois and in Coles County, and especially in the centers of Charleston and in Mattoon as well. And so people don't like to talk about it, except this guy here, and hopefully now some of you, but I thank you for your time, for your attention, and I guess that's going to be it for me. Thank you.